Welcome everyone, and thank you for coming. My name is Cindy Cutter, and I'm the Director of Marketing here at the National Institute for Children's Health Quality, or NICHQ for short. We've had an incredible response to this webinar topic with over 5,700 registrants, which really just speaks to how much this topic resonates with folks. We're so pleased that you're able to provide you today with some strategies and tools to help making what can sometimes be challenging conversations about safe sleep environments a little easier and, more importantly, more effective. I'm thrilled to welcome Stacy Scott of the Global Infant Safe Sleep Center and Jennifer Ustinov, a NICHQ Senior Project Director, who are both going to help facilitate the session. Feel free to type in questions into the chat box at any time during the webinar. But before we jump in, I'm just going to take 2 minutes to tell you a little bit about NICHQ and why we are invested in this topic. So NICHQ is a nonprofit organization that for nearly 20 years has solely focused on driving dramatic changes in the complex issues facing children's health. On this slide here you see our mission and our vision, and at the heart of what really motivates us is the belief that children and families deserve better systems and supports so that every child achieves their optimal health. At NICHQ, we like to say we don't just talk about making change, but that we make it happen. In more than 80 initiatives spanning over 20 health topics, we've worked in partnership with subject matter experts, communities, and families, like many of you on the webinar today, to build and execute strategies that drive improvements in children's health systems. And I encourage you to go onto our website where you can see examples of this in many of our case studies.
So on this slide, you see a snapshot of our current portfolio of initiatives, and it's a variety of health topics and includes both state-based and national projects. And on the right-hand side under infant health, you see 2 projects there that are in bold, because those are specifically about infant safe sleep. And that's why this webinar topic is so relevant to us. So just to tell you a little bit more about those 2 projects, the National Action Partnership to Promote Safe Sleep Improvement and Innovation Network, which goes by NAPSIN for short, is funded by the Maternal Child and Health Bureau, and it's focused on making safe sleep and breastfeeding the national norm. It's the multi-year initiative. It started with 5 pilot hospitals in 5 states, and it will eventually expand to include additional hospitals, some social service agencies, and child care touchpoints across the country. And we're privileged to have a coalition of 70-plus stakeholder organizations that are supporting this initiative with us. Second is our Safe Sleep Coin to reduce infant mortality, and that project seeks to reduce sleep-related deaths in 4 states and builds on the work of the National Infant Mortality Coin Project that NICHQ co-led with the Maternal and Child Health Bureau. In both these projects, NICHQ brings deep content knowledge, expertise in quality improvement science, and experience in addressing the social determinants of health to make sure that no babies are dying unnecessarily in their sleep. And that brings us to why we're here today. So our first facilitator, Jennifer Ustinov, is going to provide some context and statistics that reinforce the need to improve the conversations so that we're all better able to help families adopt safe sleep habits. And from there, Stacy Scott will kick off 2 role-play situations that demonstrate some really great tactics to engage families from different backgrounds in meaningful conversations about safe sleep. And then we'll end the webinar sharing some resources that will continue to support you after today. So with that, I'm going to pass it off to Jennifer.
Thank you, Cindy, and welcome everyone. The U.S., I'm just going to get my pointer working. The U.S. has one of the worst rates of infant mortality of all industrialized countries. For a country that spends so much money on our healthcare system, it really is quite tragic that our infant mortality rate is so high. Infant mortality is one of the most important indicators of the overall health of a nation, prompting us to ask what the U.S. rate tells us about our nation's health. Also, establishing and supporting a sense of urgency is the fact that in the U.S., Black babies die at more than twice the rate of white babies. This graph shows us the trends in sudden unexpected infant death or SUID rates in the United States from 1990 through 2015, and also breaks out infant deaths due to SIDS, unknown causes, and accidental suffocation and strangulation in bed. In the 1990s, the U.S. experienced a marked decline in the SUID death rate, demonstrated by the top yellow line in this graph, due to focused initiatives such as recommendations from the AAP and the National Back to Sleep campaign. Looking into the 2000s, it could be argued that although SIDS rates did improve, the overall SUID rate has generally plateaued. According to the CDC, approximately 3,700 infants die every year due to sleep-related deaths. That is an alarming enough statistic, but even more so when we do the math. This translates into 10 babies every day, meaning a family suffers the loss of their baby in the U.S. from a sleep-related death every 2 to 3 hours. This pie chart looks at the 2015 SUID rates by cause. We define SUID as death of an infant younger than 1 year of age that occurs suddenly and unexpectedly. This includes suffocation, entrapment, infection, trauma, and sudden infant death, among other causes. We see that in 2015, 25% or 90 infants died from accidental suffocation and strangulation in bed. These deaths are preventable. This stacked bar graph shares the U.S. SUID rates per 100,000 of live births disaggregated by race and ethnicity between 2011 and 2014. The glaring disparities here prompt us to action. We are forming partnerships and developing innovative strategies that will support and move the knowledge of safe sleep and safe breastfeeding practices toward changes in behavior. When we consider the populations we serve and seek to influence, it is also important to consider the data that we have on who is more likely to place their babies in unsafe sleep positions or environments. These data are not for judgment, but rather promote us and provide us the opportunity to have conversations with all mothers with an intention to reduce our inherent biases, seek to understand their circumstances, and support and influence their intentions while helping them to plan to reduce their risky behaviors. These recently published data underscore the protective mechanism for breastfed infants. The dose response is evident here. The risk of SIDS is reduced the longer an infant is provided any breastfeeding, and more so when exclusively breastfed. We want to support all mothers in safe breastfeeding practices. I am now going to pass the webinar facilitation over to Dr. Stacy Scott as she moves us from looking at data to thinking about action.
I'm just here to move us into the next section of our call and really talking about what will make a difference. I am pleased to say that we have some great people who will be working with us as we go into some of our different scenarios. But first, I want to say the real important thing is as we go and try to have these conversations and move beyond just a campaign is that we as individuals who are doing the education really need to be knowledgeable. We need to know what we are talking about. Again, many of the people that we do education with are very smart and very savvy and can really ask us some questions that if we're not knowledgeable and on our game, we can kind of fall a little short. So knowledge truly is the #1 key. Understanding the risk and what it takes to reduce the risk is also very important. You will be approached with many different scenarios, and so as you're doing the education and talking, you need to be well aware of some of the risks that even maybe some of the clients might experience way beyond the standard risk reduction messages that we currently give. Modeling is a key. You know, you need to really be able to practice what you preach, to be able to show the client or whomever you're speaking with on these are the correct ways to practice both safe sleep and breastfeeding. Conversations that meet people where they are, and that is so crucial. Another piece that we don't have listed here is the sincerity in your message. Meeting people where they are, being sincere in what you're saying, being really concerned in regards to knowing that you want this person to do everything they can to keep their baby and infant safe. And then most of all, being realistic and relevant. You know, we talk about safe sleep, we talk about safety-approved cribs, but understanding that the audience, and sometimes, be it from economics or other reasons, that they might not comply 100% with the recommendations as we feel they need to, but to help them be able to do what they need to do in ensuring that their infants are in a safe place, and again, promoting breastfeeding at all costs here. I just want to go in and say that we have Martin Mays and Mark McBee. They are going to be our role play for our Situation 1. We thought this would be unique in the sense that we would have a father and also another male that would be engaging in these conversations that, you know, based on where we are, we really look at moms quite a bit and doing these type of conversations. This is a scenario where the setting would be a home visit. Mr. McBee is a firefighter. He's going to come in and talk to Mr. Mays about safe sleep and really kind of make it true that we're looking at a very chaotic daily life, and I think you'll get a lot out of this. I'm going to turn it over to both Mr. Mays and Mr. McBee to start the role play.
Okay, good afternoon, one and all. Excuse me, sir. My name is paramedic firefighter McBee. We're in the neighborhood doing safety checks and passing out smoke detectors. So if you got a few minutes, we'd like to come in and do an inspection and possibly leave some smoke detectors with you.
Well, yes, sir. I'm here with the kids by myself. My wife is going shopping with her mother, so it's a little hectic in the house, but you're welcome to come in and check my smoke detector.
All right, very good. We shouldn't be long. It'll only take a few minutes to do that. Yeah, you look like a pretty busy man, and I see you have a new little one there. About how old is he?
Yeah, he's about 3 months now. It's just rough right now.
Okay, I know how that can be, you know. If you don't mind, while I'm here, I'd like to give you some information about safe sleeping.
Safe sleeping. What is safe sleeping? I've never really heard of that.
Basically, we're advocating that you put your baby on their back to sleep alone in a safety-approved crib to reduce the risk of possible SIDS.
SIDS. Now, I've heard my wife say something like that. Is that something like crib there?
Well, sir, you know, that's what they used to term it as, but actually, we're looking at SIDS as sudden infant death syndrome, and we're looking at reducing the risk factors. And putting your baby in a safety-approved crib is the safest place to put them when you put them down to sleep. Understand me?
So the crib isn't the problem. It's just how you put your baby in there.
Absolutely, and reducing a number of other risk factors, because you know the highest incidence of SIDS is less than 1 year of age, with the highest risk period is between 2 and 4 months. So
that's my baby right there, 3 months old.
Yes, sir, absolutely. So what we can do, listing some of the, reduction in risk factors. We try to keep it simple. The fire department, with us firemen, we take too much smoke, so we try to keep things simple. So we look at it as the ABCs. The A being baby put alone in the crib, on their back, and in a safety-approved crib. That being with a tight-fitting mattress, tight-fitting sheet, with nothing in it. And I see you have a pack and play over there loaded up with a lot of stuff there.
Oh yeah, we let him play a little while, then kind of let him fall asleep in there sometime because it just looks comfortable for him.
Yeah, but You know, when we talk about reducing risk factors, that would be not having the blankets in there, not having the bumper pads, not having extra pillows. And I know all the stuffed animals look cute and everything, but they're better served being placed on the outside. So you want them, his sleep area empty of all of those materials.
And no blankets either? What if the baby gets cold?
Well, one of the things we recommend is that you can put the baby in a sleep sack, and one that is appropriate for its size, one that's not, not too big, but one's appropriate for its size. Because you know how some folks, they'll buy something and say, okay, he's going to grow into it, but we don't want something that's too big. And the key thing with the sleep sack, we also don't want to get the baby overheated, at night.
Oh, okay. See, my mother-in-law gave us a couple of sleep sacks at the baby shower, and I'm gonna tell you, my mother-in-law likes to put the baby in her bed sometime with the other kids, just as she's running around, she's babysitting and has to clean up in the house or something, and she just puts them all in one place.
Well, sir, I know it's a matter of convenience, but for an issue of safety, the baby should be in its own sleeping area by himself, not with the other kids, because you run the risk of, with one of the other kids, how hard they sleep, rolling over on top of the baby and ending up with a tragic ending. So its recommendation is, they have their own sleep area by themselves. No co-sleeping with grandma, no co-sleeping with you and the missus, and no co-sleeping with, with the other kids.
Oh, okay. So you're telling me that I just need to keep my son alone in his own crib with nothing in it and always lay him on his back. Is that right?
Yes, sir. That's correct, sir. And as a matter of fact, if need be, you can have the baby in the same room with you, but not in the same bed.
Oh, okay. So just pull his crib, or sometimes we got a little bassinet too. We can just put that in our room with us.
Absolutely.
Oh, okay. Okay. Now, what about my wife? Sometimes she breastfeeds at night, and she sometimes falls asleep when she breastfeeds. What do we need to do about that?
Well, hey, teamwork makes the dream work. So as a team, you and your wife, I know as rough as it is, because I went there myself. If she's up breastfeeding, you keep an eye on her and make sure that she doesn't drift off to sleep with the baby in the bed with you. Make sure that the baby is put back in its sleeping area so that don't accidentally fall asleep on the child.
Oh, okay. Okay. Now we know at the baby shower we got a bunch of pacifiers. Is a pacifier safe?
Well, you can use a pacifier. Breastfeeding is best, but you can use a pacifier, if there's, still suckling, and we put them down for a nap. That's permissible.
Okay. Well, I definitely appreciate all this information. As I said, me and my wife, she got information at the hospital. We just didn't have time to go over it, but
right.
When she gets home, we're going to go over this with her and with my mother-in-law to make sure we're all on the same page. You got any brochures you can leave me?
Absolutely. I can leave you some brochures, but let me leave you with this other bit of advice. With you putting your baby on their back to sleep, all your other caregivers, if you have someone else taking care of your baby, a babysitter, a daycare, even your mother-in-law, everyone should be placing your baby on his back to sleep. And also, we're going to leave you some smoke detectors, but, there should be no smoking in the house around the baby or having people around the baby smoking at any time. And I do have brochures. I will leave you some information. There's a website on here for you to check out, get more information. I'm also going to leave you some smoke detectors and some items on the safety list that we found to reduce the incident of fires. And I hope you have a good day. And in Lee, I wanted to say, you know what? I commend you because, we find that the more the fathers are involved, the better outcome we have for our babies, and I commend you with that. So keep up the good work, and you have a good day, sir.
All right, thanks, sir.
All right, take care now.
All right, thank you. Okay, so the scenario for me and Tony is that Tony works at WIC, and I'm coming in as a mom with a 3-week-old baby. Tony, you want to get started?
Yes. How are you today?
I'm well, and how are you?
I'm great. I'm great. It's so good to see you. Did you have a boy or a girl?
I had a little girl.
Oh, can I take a peek at her?
Yes.
She's so beautiful. I'm happy to see that you're good. It looks like you came in with somebody. Who did you bring with you today?
I actually brought my mom. This is my mother.
Hey, Mama, how you doing? It's good to meet you as well. So how have things been going so far since you delivered? Did you have a vaginal birth or a surgical birth?
I had a vaginal birth.
Okay, good.
Everything's going okay. You know, I'm tired, I have to say, and just trying to make that adjustment, but I'm hanging in here.
Yeah. These first couple of weeks can be really hard. You definitely want to make sure that you're getting enough rest for yourself, and know that during this, because you're just 3 weeks out, you're still in a postpartum period and should be doing plenty of resting. So what questions do you have for me today?
Well, you know, I'm really concerned. I'm trying to breastfeed. I really want to. It's been kind of a struggle. I'm concerned that my baby's not getting enough milk, and you know, I know I've read about not having any, you know, using any formula and just trying to breastfeed all the time. And, you know, my mom has been saying, I don't know if the baby's getting enough milk. And so but I'm hanging in here.
Good. It's so great to hear that you've been exclusively breastfeeding. And I can tell you must have went to one of our classes or have been reading lots of information to find out more. And the concern of whether or not your baby is getting enough milk is a common one. We hear that all the time. And so at this point, I'll just say, because that takes a couple of minutes to talk about that, if I was in WIC, I would actually go through and, you know, talk more about how to find out if he's getting enough milk, blah, 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 blah. But for this call, we'll go ahead and move forward. So tell me more about how many times a day you're feeding the baby. Does the baby mostly nurse at night or during the daytime?
Well, pretty even. You know, nighttime, she's waking up every couple of hours, and so, you know, that's been a little tough for me too.
I remember myself of how night times were. Where's your baby sleeping at during the night? Is your baby sleeping with you or in a bed or in another room? Talk to me more about that.
Well, you know, I'm following what they told me, the recommendations about having the crib in the room with you. But I have to admit, you know, after about that second feeding, I take the baby out of her bed and I put her in the bed with me, and before you know it, I do fall asleep. And so then I wake up and then I'm in a major panic, you know, and you know, but, you know, I feel the baby is safe and I haven't had any problems. So, you know, I just got with you. I've been keeping the baby in the bed with me.
Okay. I have a pamphlet here with more information about safe sleep. Have you ever heard more about this?
Well, yes, I've read that. I've been, you know, I got a lot of information from the hospital and with a lot of pamphlets, but, you know, I've been just kind of, it's been hit or miss.
I understand. So right now you're just in survival mode, which is normal and something I totally expected that you would be in at 3 weeks. Are you back at work yet, or are you still at home with your baby?
I'm still at home.
Okay, good. So it's really important to go over the information about safe sleep practices because, of course, after you get back to work, things are going to be a lot harder. You're going to be more tired, and it's really important to ensure that your baby is always placed safely to sleep. So here I have a pamphlet, and at this point I would give a pamphlet to mom and also the grandmother since the mother is present. So in this pamphlet, let's talk a little bit about some of the things to keep your baby safe during sleep. So I heard you say that babies going to bed with you at night, and I can honestly tell you most breastfeeding mothers find themselves in that situation. When you're breastfeeding, your body secretes hormones that ensure that you and your baby are able to go safely back to sleep. And we call them the love hormones. They are really comforting for you and your baby, and so often moms drift off to sleep. And so, of course, some people would get up and sit and nurse in a chair, and we know that's also sometimes a risk because, of course, mothers could inadvertently drop baby, and not intentionally, of course. So let's talk about your nighttime. So when you first start off during the night, it's really important to start setting up a routine with baby. So if baby's in your room in a safety-approved crib, then you want to make sure that that's where you're constantly putting baby when it's time for sleep. Show baby that, okay, this is what we're going to do. Maybe even do a pattern of bath, a book, and then bed, ensuring that baby starts learning some of that stuff early on. Now tell me this. Tell me more about your crib that's in your room.
Well, you know, it's a crib. My mom gave it to me. It's a brand new crib. And I know it said don't put bumper pads. You know, I did read that, but, you know, my mom was just really concerned about, you know, that hard crib and not having any pads around it or whatever. So we kind of went back and forth with that, but I finally convinced her to, you know, maybe we shouldn't do it. So can you give me a little bit of information about that?
Yeah, of course. And for your mom, what's your name? Mom, what's your name, Mom? Grandma?
Miss Scott. Mrs. Scott.
Okay, so for you, Miss Scott, I'd also show you this part of the pamphlet where it talks about how babies sleep better when they don't have anything in the crib. It's also important to ensure that we have a safety-approved, a fitted sheet that's appropriate for this particular crib that you so graciously bought for your daughter. Thank you for that. And so it's important when we talk about bumper pads because often we think about the safety of the baby like falling through the bed or anything like that. But now we know that cribs are formatted for babies and to be a little safer where they don't have to worry about actually getting hurt when that way. Our biggest concern is that if baby was to get against the bumper pad, she might get in a situation where she can't actually breathe as well as we need her to and can sometimes die from that. So we want to make sure the baby has nothing in the bed, the sheet fits the bed, and then so babies need to always be placed on their back to sleep. And also with just with the layer. So you put baby in what we call a feed-in or a gown or something like that, and baby doesn't need a cover at all.
Oh, okay. All right, then. Another big thing I got a question about is a pacifier. Now, I know in talking to the lactation person in the hospital, you know, they said that I need to make sure that I have breastfeeding established, but I read in the material about being able to use a pacifier. Could you give me some information about that?
Of course. So the recommendation of a clean dry pacifier comes from a space of ensuring that your baby's waking often instead of causes them problems sometimes. So when you ensure the baby has a clean dry pacifier, and we'll talk more about breastfeeding established, when they're doing that, they're waking up to suckle, and so it's important for them to have that. Now, if you are breastfeeding, your baby's waking up anyway to eat, your baby's going to be waking up every, not 15 minutes, but every 2 to 3 hours to wake up. And so a clean dry pacifier is not necessary a necessity until breastfeeding is established, only if, it works for you and baby. And when we talk about breastfeeding established, we're talking about that time period when you're sure baby's getting enough milk, you guys are going along smoothly, baby's getting clean or wet and dry diapers, and maybe we say 4 weeks to 6 weeks after you've had your baby. So that's the time that you're looking for to do that.
Okay. All right, then. Well, that helped me out a whole lot. I really appreciate that.
Okay. Do you have lots of questions? Oh, so when you said that baby was going to bed with you at night, what do you do to ensure that you don't fall asleep for the entire night with baby?
Well, I don't do a whole lot. I just work very hard to try to keep myself awake, but, you know, I have to admit that sometimes I do fall asleep.
Yeah, and that's common. Like we talked about those hormones that are there. I can tell you one thing that's helped with some moms. If you set your smartphone, because I know you have one, because we all do. If you put your smartphone on, say, 15 to 20 minutes, and even if you put it on silent, you can put it up under yourself, and then and it vibrates, and so then that way it'll wake you up. And so of course, even with that timer, you can hit it to do another 10 minutes or whatever if baby's not done eating, and then at that point you can place baby back in their bed to sleep. And then that way you're limiting the amount of time the baby's actually in bed with you.
Oh, well, I never thought about that. So you just basically set the alarm on your phone, and it can just wake you up and make sure that you don't go into a deep sleep.
Exactly.
Okay, well, you know, that definitely helps me out. I appreciate you with all the information, and
no problem.
Look forward to seeing you in our follow-up visit. And my mom, I'm glad that she's here so she can hear this information. You know, I'm just trying to get her to understand about, you know, what we need to do to make sure that, you know, everything's okay, and that, you know, and now I think we got a better understanding about why putting a baby in their own crib and on their back is so important. Thank you so much.
You're welcome, and congratulations to two of you guys. Congratulations on being a new grandmother, and congratulations on being a new mom.
Thank you. Okay.
Have a good day.
Thank you. We wanted to come up with some key takeaways for successful conversations. And as you heard within these particular scenarios, number one is be supportive without judgment. You want to clarify the risk factors. You want to state desired behavior. For example, as you see, nothing but the infant in the crib. You want to ask questions about factors that influence sleeping environments that aren't easily visible, and I think you heard that both conversations, and especially with the WIC counselor and the mom, consider who the influences are in the family. We heard mother-in-law. We had mom sitting right next to the young lady at the WIC visit. And stress educating all caregivers about safe sleep practices, which you did hear in the conversations. I think Mr. McBee hit it on the head when we talked about Fathers Matters. It is very important, and I know a lot of times they are left out of the conversation, out of the dialogue. And we just wanted to add this slide to say that when fathers are involved, children thrive in school, in their development. So it should be no surprise that when fathers are present in the lives of pregnant mothers, babies fare much better. We know dads can help influence and promote breastfeeding, also look at promoting safe sleep practices. So we ask you please to always consider them, and if they are available, bring them in the conversation. And the takeaway for the conversation that I had with Ms. Hill in the WIC scenario is active listening to support what is possible to reduce the risk. The issue was she was falling asleep at night with the baby in the bed, and Ms. Hill did give some good feedback on how to address that. Acknowledge what you heard, share what you have seen work, make sure that there's the knowledge that behavior can change, and identify where to turn to for additional support.
Thank you so much, Stacy. We're going to pass it back to Jennifer to talk a little bit about what's next and to share some additional resources.
Thank you so much. I think that, we could have a webinar where we gave, provided a lot of strategies, but we really wanted to share with you that role play and how those conversations come up and how you can really work with families and ask them where they're at and really then adjust to those guidelines, reinforce the guidelines, and support through a strengths-based approach to really have them identify what they can do and what they are doing and to reduce those risks. So I really want to thank the four of our role play actors and actresses, and I think that we all can get a lot out of how we break down those conversations and sometimes just take the time to have them. So we wanted to provide for you a few resources that you can follow up with. And the first one, Campaigns to Conversations. These modules, they're learning modules and they're free. If you click on this link, and they were created through the first iteration of the NAPS funding, and they are really well done. They help us think about how do we have these conversations. They give background to the challenges around safe sleep and breastfeeding, and they are very well written and can be used for staff education across your interdisciplinary staff. So I really urge you to look into those, and you might be able to take pieces of it that pertain to where your education is at or beginning your education. Then the next one is the Infant Mortality Prevention Toolkit. This is another great resource. If you haven't accessed this came out of the IMCoin and is something that was contributed from all the learnings from across the nation and all the states and partners that participated in IMCoin to actually move the needle on infant mortality in this country. And then we wanted to share with you that you have an opportunity to become Friends of NAPS. And so this is our Safe Sleep initiative that is looking at safe sleep and breastfeeding. And we have a newsletter that goes out quarterly, and if you click on this or go to this particular link, then you can become Friends of NAPS, and you'll keep up to date on what's going on with this innovative work and what we're learning as we go. And it also gives you an opportunity to connect to other webinars and learnings and resources. And then finally, there are so many resources we could have given you, but we wanted to highlight these four. And the last one that we want to highlight is the First Candle webinar. And again, this is another opportunity to really think about safe infant sleep and how to individualize your approach as you work with mothers, generational families, and all the supports that mothers and babies need. So that link is there. It's on May 2nd, which isn't very far away. It's hard to believe, and it's at 12 noon Eastern time. So do tap into that or have some of your staff and colleagues think about joining that webinar. We want to thank you today for joining and also being partners with us in really thinking about how we can move the needle on this, do things a little bit differently, be creative, but most importantly, listen to our families. And as Stacy so well said, that we really need to meet them where they're at and find out what is possible and as we support them and influence them. You can learn more on our website at www.nichq.org.
Thank you so much, Jennifer and Stacy, and for all our participants in the conversations. We actually have a ton of questions in our Q&A, and so I'm going to read them out loud, and hopefully Jennifer and Stacy, you guys can see how many we can get through in our 12 minutes left. So one question is, what can I say to a parent that says the child only sleeps when on their stomach?
This is Stacy. I'll answer that one. I get that a lot. And the bottom line is that you just have to reiterate the message. Normally I say, yes, I understand that. You know, I can agree with that. I know babies who sleep on their stomachs have a tendency to sleep longer and through the night, and they go into a deeper sleep. But unfortunately, you know, even though we don't know what causes SIDS, we do know that there is some brain stem abnormalities or issues that does not cause, that allows the baby to take their next breath. And so when they go into a deep sleep, like the sleep they go on their stomach, it just causes a little bit more concern and might create a bigger risk because they are in such a deep sleep. So the recommendation is putting them on the back, and, you know, maybe, again, that mechanism can trigger even because they're not sleeping as deep and sound as they would be on their stomach. And the other thing I say, you know, even though them sleeping longer might be better for you, it might not be best for them. So putting them on their backs just seems to be a better solution.
Stacey, I really like that approach because I think we are so driven to go to sleep. As adults, any of us that have been sleep deprived, we know how attractive that pillow and that bed looks to us. And so we're really driven to have the baby settle so that we can go to sleep, so we have more to give. And I think turning it around and really being able to say that deep sleep might not be as safe for the baby. And so this, unfortunately, is that time period where the baby might not sleep as soundly, and so therefore neither will you. And so you got to think about the strategies for when you can catch some sleep, how you can get other folks in your family or friends to support you. And then I also think about asking them how they're swaddling the baby, like, you know, and see if there are some comfort measures there with proper swaddling that might settle the baby a little bit more, minimize a little bit of noise. But I think it's really that biological approach and the sad fact that we really do need to have our babies not sleep so soundly in these early months of their lives.
Okay, thank you. So we have a bunch of questions around co-sleeping. You know, and one I think that kind of sums up what a bunch of the other ones are saying is when a mother's committed to co-sleeping and then asked how to do that as safely as possible, what would we actually say to them?
Well, first, I would like to kind of make some clarification. A lot of times, co-sleeping is used interchangeable between bed sharing and also room sharing. So if we refer to the term as co-sleeping, and when you're doing education, understand that co-sleeping is the umbrella of either bed sharing and room sharing. So I would suggest as you're doing your education, you want to make sure that you say, we recommend that you room share, okay, and that room sharing, we understand, can reduce the risk of SIDS. It can reduce infant mortality. Bed sharing is not good because of the fact you are in an adult bed. There's a lot of pillows and blankets. It's so easy for that to fall over, or if there's two adults in the bed or other siblings, somebody can roll over the baby. And so, you know, I think we need to kind of be real careful when we talk about co-sleeping. The question would be if you would say, how are you co-sleeping your baby? And when you would say that, those two options would either be bed sharing or room sharing. So that's my first thing. But definitely you want to talk about the importance of room sharing versus that of bed sharing.
The other thing that I would say is we want to reduce risk, and we're not, you know, we're not going to change everybody's mind. And so it's the very same excuse me, situation that we were hoping to portray in the role plays to meet moms where they're at. So how do we reduce the environment when the mother is sleeping in a bed, if that's what she's doing? And I think investigating exactly what she means is really important, and is there opportunities to do it less often, or, you know, just understanding those risks. But getting the extra pillows out of the way, making sure that there isn't a big fluffy down blanket, you know, those kind of things can help also to reduce the risk. It doesn't eliminate it, that's for sure, but I think it's one of those conversations where you know that this mom's going to do it. So how can you talk with her about reducing the risks when she is committed, as the question says, to having her baby sleep in the bed with her? But I think it really is a conversation, and again, it gets back at that approach of making sure that we are open to her situation and her opinion, and our biases don't come through, and we're not going, oh, it's one of these, and yet we say, okay, so I understand that, tell me why, you know, and just kind of investigate that a little bit and really have that conversation, and then talk about some steps that could help minimize the risk even though they are choosing to do this.
Great, thank you so much. It's really great having both of your perspectives on each of these questions. So we had two other themes that kind of are popping out, a little bit about asking if you can talk about breastfeeding and why that's helpful in reducing SIDS and SUID. And then a second one around acid reflux and some concerns where parents wanting to put the baby on the stomach because they think that that will be helpful. So I'll put those both out there. Feel free to go after each one.
All right, Tony, you want to talk about the breastfeeding?
Yeah.
Or did we lose her? Did we lost her? We know that, again, and I as far as the breastfeeding piece is, my true claim to fame is safe sleep, but I know that breastfeeding is just better all the way around. I can't give you the medical background, but maybe Jennifer can, but we know that breastfeeding and breast milk is just key to keeping infants healthy. And there's a lot of things and great things about that when I try to promote to the people that I do a lot of education with, I just place emphasis on that. But I'm going to turn that over to Jennifer to give you the more medical aspect of it. Jennifer.
So I don't have enough time. there is, this is going to sound like I'm kind of brushing off this question, and I really don't intend to do that. There is a plethora of evidence out there that links the protective mechanisms of breastfeeding. And remember the slide that I showed. It isn't exclusive breastfeeding. It has a dose response, and so any amount of breast milk and breastfeeding is protective. Yes, there is a higher or a lower reduction shown in rates of SIDS when you breastfeed longer, and even more when you breastfeed exclusively. But any amount of breastfeeding has been shown to provide that protective mechanism, and it is very much there out in the evidence, and the information is there that you can look up and you can bring to a conversation, whether it's part of your staff conversation or something that you research on your own. But there's lots out there. All you need to do is Google breastfeeding safe sleep, and you will get lots of conversations about the protective mechanisms and data. And we can certainly provide more. We can put some on our website that can help and give you some resources for that also.
Great. Thank you both very much. Did either one of you want to tackle the question around acid reflux?
Oh, yeah. Go ahead, Stacy, if you'd like.
No, you do it. No,
okay. So there is a really nice picture of a baby and what the baby's esophagus and windpipe do when you lay them on their back versus when you lay them on their tummy. And this is a really common complaint, worry. And we don't want to disregard those concerns, because we want mothers to be worried about their babies and being protective of their babies. And so we can also post that picture for a resource on our website, and it really is very, very telling about where the esophagus is and how when the baby actually lays on its back, there's more of a block from the reflux, as the question said, up into the baby's mouth. And so it is biologically a fallacy that if you put the baby on their back that they will choke. And so it's been a very helpful visual for mothers to feel a little bit more confident, and also for them to be able to use that when they talk with their moms, because all of my babies were on their backs, and so I could be that, or on their tummies, and so I could be that grandmother that felt more comfortable with that. And so we really need to use those types of visuals to aid our moms in understanding themselves, but also the people around them that are influencers, and sometimes very strong and powerful influencers that they don't want to disappoint or go against.
Thank you, Jennifer. Stacey, did you have anything you wanted to add?
Oh, no, I just wanted to follow up. And when you're doing education, and I know we use the trachea and esophagus, but a lot of times I just take it down into the windpipe and the food pipe. And believe it or not, people, when you're doing that education, especially when you're doing it a lot with grandparents and whatever, that, you know, we talk about that whole gravity piece and showing where you have the windpipe again on the top as the baby is laying on their back. And so you can show that in a picture, that if a baby's laying and their face is turning from one side to the other, and they do vomit, that the food would run out the side of their mouth. And that is one of the biggest things and obstacles that we experience, especially when we're working with grandparents, in convincing them that these babies will not choke if they're laying on their back. So, you know, again, be cognitive of the audience that you're working with and the terms that we use. And I just wanted to add that.
Oh, that's a really good reminder coming from a medical background. We all need those little reminders to not use those words that we feel comfortable with. Thank you.
You're welcome.
Well, thank you both, Stacey and Jennifer, and to Tony and to Martin and to Mark. We really appreciate you guys sticking in with us today as we experience some technical difficulties, but hopefully you're walking away with some great resources that you can turn to, as well as some ideas and strategies to use in your conversations going forward. We'll be sending out the recording and the slides, and we'll also try to answer some of the other questions that came into the chat that we weren't able to get to on the call today. So thank you again for coming. Have a great rest of your day.
Thank you. Bye-bye.